Two of the most exciting areas right now in cancer therapy are targeted therapies, that is, drugs that are specifically directed against a particular mutation in cancer, and immunotherapy, therapies that are designed to stimulate the immune system to recognize and fight cancers. In some ways, these are complementary strategies. Targeted inhibitors are associated with a very high response rate. They are very effective in the tumors that have a particular mutation that's targeted by these drugs. But the benefit from those drugs is not as durable as we wish it would be. That is, almost all the patients treated with a targeted inhibitor will eventually relapse. Their cancers come back and ultimately progress. Immunotherapy, in a way, has a different profile. That is, a smaller fraction of the patients are apt to respond to these therapies, but those patients who do respond may get a durable benefit, may get a long-lasting benefit. And as we get more experience with these drugs, we're finding that the tail of the curve, the tail of the survival curve, is extending out farther and farther. The goal of this trial was really to combine those two strategies and maybe get the best of both worlds. That is, to give Erlotinib, a targeted inhibitor for EGFR mutant lung cancers, together with Atezolizumab, an anti-PD-L1 antibody, with the hope that the Erlotinib would induce major objective responses in patients with EGFR mutant lung cancer, and the Atezolizumab might then give a benefit in terms of immunotherapy, in terms of essentially training the immune system to recognize these cancers and prevent emergence of acquired resistance. So that was the goal of this strategy. This was a phase 1 study combining these agents really for the first time. So part of the goal was safety and dose finding. There was a phase 1 component of the study to show that this was a safe combination, and that phase of the trial actually enrolled patients regardless of EGFR mutant status. Then there was an expansion cohort which was limited to patients with EGFR mutant lung cancer who had not previously seen Erlotinib. And in that cohort, we were looking both at continued safety evaluation but also efficacy.